The muscles of the human heart receive their own blood supply from vessels that branch from the aorta. These are known as coronary arteries. Throughout a person's lifetime, these vessels commonly become partially or fully blocked by a buildup of plaque, a process known as atherosclerosis. This will prevent sufficient oxygenated blood from reaching the muscles of the heart wall. This leads to symptoms of coronary artery disease. This most commonly results in chest pains known as angina, caused by myocardial ischemia, as a lack of oxygen to the heart muscle wall causes it to deteriorate. If left untreated, a further buildup of plaque will ultimately lead to heart failure. In order to alleviate or prevent these outcomes, a person will undergo coronary artery bypass surgery. A blood vessel will be removed from areas in the body, it will be stripped of any surrounding fat, and all branches will be tied off. The vessel will then be stretched in order to prevent spasms. Once prepared, the vessel will be grafted onto the heart to bypass the blocked coronary artery and alleviate the symptoms of heart disease. Unfortunately, within the first year of surgery, up to 30% of bypass vessels will fail. Research has found that the method of removing and stretching a bypass graft can have significant impact on the likelihood of this bypass failure. These two images depict a cross-section of the human saphenous vein, a vessel frequently used in bypass surgery. The vein on the left has been removed from the body with fat still intact around the outer layers of the vessel, and it has not been stretched. The image on the right, however, has been separated from surrounding fat layers and stretched. The cell structures that make up the vein have been significantly damaged during this process. This 3D depiction of the vessel has been created using data from a human saphenous vein. In the normal vessel, an internal layer of endothelial cells line the inside of the vessel. They facilitate gas, white cells and nutrient exchange between blood and surrounding tissues. This is surrounded by a thin layer of elastin proteins that aid in the maintenance of structure under the pressure of blood flow. Smooth muscle cells surround this layer, innervated with small elastin and nerve fibers. The outermost layer consists of further smooth muscle cells, elastic fibers, and collagen that attach the vein securely to surrounding fat. This fat is innervated with smaller blood vessels that supply the outer layers of the vein with a sufficient supply of oxygen. These images are based on data taken from the stretched vessel. Endothelial cells within the internal layer of the vessel have become displaced and gaps have occurred, and smooth muscle cells have become exposed through the layer. The smooth muscle layer has been compressed, causing damage to the nerve and elastin fibers that aided in the effective constriction of the vein to maintain suitable levels of blood pressure. The removal of fat from the outside layer of the vessel has also removed the innervation of blood vessels that supplied the outer layer of the vein with a suitable oxygen supply. This damage, especially that to the endothelial cells, has been linked to vascular conditions such as hyperplasia, atherosclerosis, blood clots, and stenosis. These conditions all cause blood flow restrictions to develop within the bypass vessel. As one of the leading causes of heart failure to date, the significance of cell damage during bypass surgery must be considered in order to improve graft success rates and overall patient care.